Greetings, everyone. My name is Ellen Kahn. I use she, her pronouns, and I'm the Senior Director of Programs and Partnerships at the HRC Foundation. And in my role, I have the honor every day of working on programs that help to promote the health and well-being of LGBTQ youth. We do that by working with families, working with schools, working in healthcare and child welfare and other systems of care, and with the broader community to make sure that LGBTQ youth can be safe, supported, and can thrive across their lives. With this new funding from Gilead, we'll be able to invest further in making sure that LGBTQ youth, and especially youth of color who've been disproportionately affected by HIV, have the resources they need through inclusive, comprehensive, LGBTQ inclusive, comprehensive sexual health education, which is lacking in far too many schools and lacking in conversations at far too many dinner tables across our country. Today, I'm joined by three amazing young people who are going to shed light on this important topic and help us understand what all of us can do to really change the landscape so that young people like them, their peers, and the folks they're trying to advocate for can really fare well in terms of health and well-being. Avi, can you please introduce yourself?
Yes. Hello, my name is Avi Pacheco. I use he, him, and she, her pronouns, and I am a youth ambassador with the Human Rights Campaign.
Thanks. Viandre?
Hi, I'm Viandre Mitchell, a proud Black Latinx trans woman of color, and I'm also with the HRC 2021 Youth Ambassadors.
Awesome. And Armante?
Hi there, I'm Armante Butler. I use he, him, and his pronouns. I'm the Senior Program Manager of LGBTQ Health and Rights and Advocates for Youth.
Excellent. So before we get into our conversation and some questions I have for all of you, I wanted to just take a couple minutes to frame the conversation. So the CDC HRV surveillance data tells us that young people, especially Black and brown people, gay and bi men and trans women, especially in southern states, from ages 13 to 24, are getting HIV at alarmingly high rates. And we also know from the CDC's survey of high school students, which is done every 2 years, that LGBTQ youth are 4 times as likely as their peers to experience sexual violence, dating violence, and to have experienced non-consensual sex. So clearly, we are not doing enough to support these particular young people. We also know from a survey HRC conducted in 2017 of over 10,000 LGBTQ teens that there are major gaps in sexual health education. Only 11% of those teens reported having sex education in school that was in any way relevant to them as LGBTQ people. That plus a patchwork of state laws, from states that have no promo homo laws to those who only fund abstinence-only curriculum, really leave our young people very vulnerable. They don't know how to safely navigate relationships. They don't feel confident. They don't feel seen. They don't feel visible. So in short, we've been failing our young people. And today we're going to try to get on a path that helps all of us do better. So we're going to start. Sexual health education is a pretty big topic. Armante, can you tell us what are the basics? Like, what is sexual health education?
Yeah, so thanks for this question, Ellen. At Advocates for Youth, we recognize that comprehensive sexuality education is medically accurate curriculum that provides young people with positive messages about sex and sexuality in a way that views sexuality as normal, healthy parts of their life. When I'm talking to young people, providers, et cetera, about comprehensive sexuality education, I kind of frame it around looking at it as a buffet. So it's important that, we're talking about consent and healthy relationships, puberty and adolescent development, sexual and reproductive health and anatomy, gender identity and expression, sexual identity orientation, but also, as you mentioned, HIV and STDs. Comprehensive sexuality education also focuses on social pressures and influences. It's based on research and theories. And it also includes, cultural values and norms that affirm Black and Latinx youth in the classroom and beyond.
That's great. So it's a lot, and it's not just what you're learning in your health class. It's what you're learning through navigating relationships at school and having conversations in classrooms. And of course, hopefully we're learning something at home as well. that sets us up to be successful. We talk about K through 12 comprehensive sexual health education, and a lot of folks might not think about, well, what do you mean like K through 12? What do you do in kindergarten, first grade, second grade that's connected to these topics? Can you speak a little bit to why early intervention and early conversations are so important?
Yeah, no, I think that's a great question. So early conversations really reaffirm LGBTQ young people. You're teaching in the class, you might not know an identity of a student. So when we're talking, there's all these questions about elementary school and kindergarten LGBTQ sex ed. At Advocates for Youth, through our curriculum, rights, respect, and responsibility, we see that, elementary school sex education includes consideration to different kinds of family structures. So that's adopted families, that's extended families, families with same gender parents. It also looks at gender roles and gender neutral language. For example, relationships may be described as when two people are in love, or a couple, or two mommies or two daddies, while explicitly not discussing sexual orientation, as it's a complex term, as we all know. It also really looks at keeping that, early lessons are inclusive, and so that folks are able to be supportive of LGBTQ education and relationships while remaining developmentally appropriate. It's also recommended in elementary schools to not separate students by gender. We know that, folks on this call, that it's going to cause emotional distress, but also that, folks that might identify as transgender or gender nonconforming might not be, as accepting or feel comfortable being in a group that is different from the gender that they actually identify as. We actually have a K through 12 curriculum that really is known as 3 Rs that notes LGBTQ sex education that's inclusive. And we do that through gender roles and talking about a story known as My Princess Boy by Cheryl Kilo Davis. And it really describes a boy who's very interested in pretty things or girly dresses. And it allows students, specifically second graders, to really think about what messages are they receiving about gender. And is gender for a certain person, or can everybody experience gender in their own way?
Right. Yeah, it's really important that we're not actually talking about like being sexual and engaging in sexual relationships when we're talking to kids in kindergarten, first, second, third grade. But we're building some of the social skills they'll need to have relationships where they can say what they like, what they don't like, what feels safe, what doesn't feel safe, those kinds of things. So pivoting a bit to hearing from some of those young people, both Avi and Viandre, if you can answer a question about when you think to some of your earlier memories of learning about these topics, what comes to mind about, if at all, where you were introduced to these topics, and was it positive, was it negative, was it neutral, something else? Viandre, do you want to start?
Of course. Well, just being introduced to all of these topics, not only with sex ed, I didn't have a lot of experience because they would put me in the girls' sex ed, but I couldn't really get any good information, and that information needed to further be learned later on in life, which is not very helpful. I'm lucky that I had a doctor to guide me through that, but if I didn't have that, and many trans people don't, it's just frustrating, and you have to find out so much on your own, and that's something that should not happen. It should be within schools.
Do you recall any experience, like hearing anything that really felt very like othering or very stigmatizing to you?
Not in specific, but it's just that we've been so sexualized, and just feedback from parents that like I'm going to be a predator while going to the bathroom. Well, these are little stereotypes that get pushed later into sexuality and gets pushed into your mental health. So that's furthering what I've had feedback from.
Thank you for mentioning mental health, because we do see connections between, having positive affirming messages about who you are, and your mental health. And so we want to make sure that when folks who are charged with teaching sexual health education understand that they are promoting, physical and mental health of young people.
Exactly.
So Avi, what about you and some of your kind of earlier recollection of what you learned or didn't learn in school that helped you or didn't help you?
So my sex ed experience in grade school wasn't very helpful at all. The only sex ed class I remember having was in 6th grade, and the primary focus was abstinence. We briefly talked about like puberty, and I just remember like students laughing and like giggling. It was such like it was just a very awkward and uncomfortable environment in the classroom. The teacher just sort of like skimmed through everything. I remember someone attempting to bring up something about like gay identities, and it just got dismissed, and we just carried on. It was seen as too taboo of a topic to talk about. But yeah, leading into what Beyonce was talking about, like me being a young queer kid, I was so eager to learn things and figure out what exactly was going on with me, because I knew I was gay very young, but I quickly learned in my home life with my family and at school and just in society in general that what I wasn't okay in the eyes of a lot of people. And same as me, I didn't learn anything until I grew up and I had to learn everything on my own. And I was very reckless, so I'm very grateful that I was able to come out of that. But that's a story that a lot of queer people share.
Yeah, I think it's worth sort of emphasizing that point that you got little, if any, education. Gay identities were dismissed, and you said, "quote you said that you were reckless," but really was the failure of those who were supposed to prepare you to, for safety and autonomy. That the recklessness came as a result. And I think it's important to remember that, the adults have the responsibility to set the younger people up. I mean, young people don't intentionally, like recklessness is usually not intentional. It's because you don't have enough information to make a range of other decisions. So I think that's a really great point that you made. So I mentioned a couple times that it's not just at school or in sort of after school programs and those kinds of things that we're learning sexual health education. Our earliest learning is usually at home, like our family members. Is there any kind of conversation about sexuality, about relationships? What's being modeled at home and those kinds of things? So when you, Viandri and Avi, when you reflect back on your childhood in your homes, do you feel like there were adults, whether parents or other adults, who helped you with kind of some basic knowledge, your understanding sexuality, understanding relationships that felt helpful or realistic to you? Viandri, you can start.
Yeah, for sure. I was lucky to have a supportive mom. And with that, she took me to advocacy groups. And there was these little panels that we would go to, and we would have like little talking circles. And so there's this one person, trans feminine identifying, and she just basically ran down everything with relationships and how to stay safe, because staying safe is very important in these situations where people can feel very closeted and can lead to violence. So I learned about that. Just learned about like simple everyday things with how your hormones work. And that was really eye-opening for me, because I didn't really know anything other than the basic scientifics of what my doctor was telling me, not like the feelings and emotions of all.
Got it. Do you feel like a program like that might have been like a life-saving program to you and some of your peers?
It's exactly that, because I don't know, like I still keep in contact with that person today, and I have like an emotional attachment to that just because I'm so thankful for it. So if that could be taught in schools, like that would be amazing.
Yeah, awesome. Avi, can you say a little bit about what you learned from like the parents or caregivers in your life as a younger person?
Yeah, so I was raised by a single mom of 6 kids, very loving family, but my family is also very religious. It's sort of like built into our culture as well, that their mentality was very homophobic. So growing up, I was very feminine. That was always slapped out of me. It was always threatened out of me. I remember being in 2nd grade and me experiencing my first crush on a boy. And I remember being in the car with my family and asking, hey, so what does it mean if a boy likes another boy? And I was immediately met with just a bunch of slander. And that's when I started to realize that how society perceived people like me. And it caused me to feel something was wrong with me, like I was a mistake. I was made to feel that I was a sin. And it just really messed with my head as a kid growing up. I grew up just from what I was then to what I am now is such a dramatic difference. I became so within myself. I never spoke. I couldn't even like order at a drive-through or like I couldn't. I just wasn't social at all just because I was going through this internal battle and just trying my best to navigate my childhood. Which already had its own set of traumas, but also trying to figure out my own identity and sexuality. So it was pretty rough. Yeah, that's pretty much it.
Yeah. Well, thanks for sharing. I mean, that's really, it's a lot of pain to hold. And I think, what comes to mind for me when we're thinking about the role of our parents and grandparents and aunties and uncles and teachers and school nurses and all these folks is just like you really missed out on some, important childhood. You missed out on having access to some of the same kinds of relationships. Like if there had been, in an ideal world, right, some like excitement about a first crush, whether it's on a boy or a girl or anybody, like that really changes the path for a young person versus that sort of getting pushed down or shamed or stigmatized. So thank you for sharing that. I mean, we need to understand the impact of what we say and do on young people. Monty, let me turn to you for a minute. So I believe in studies of parents, something like 70% of just parents in the general population do want their children to learn comprehensive sexual health education. They probably want that because as a parent of teenagers, I'd say like it's kind of hard, even an open-minded person, like it's kind of hard sometimes. So yeah, I wouldn't mind some help from folks if they're doing it well. But it seems like it's still a heavy lift for a lot of adults. What do you think might be operating? Like, why do you think it's hard for parents and other adults to have some of these conversations with young people?
Yeah, I think that's a great question. And, again, like me talking to my parents and stuff, difficult stuff, right? But I do think it's really hard for parents to have these conversations for several reasons. One of those reasons includes the fact that they might have never received comprehensive sexuality education. So how can they teach it to somebody else? Or they might not have been prepared to have these conversations. At Advocates for Youth, we recognize that, effective sex positive parenting starts with understanding a parent's own sexual history or journey. So we use this resource from sex positive families to engage with parents. Some of the questions are, how sex positive was your own upbringing? In what ways does this influence your experiences with sexual health, your body image, your relationships? What does a sexually healthy child mean to you? And through these kind of approaches, we're able to have parents say, oh yeah, I didn't receive, medically accurate info. But it really does start the conversation of, having them kind of unpack what they know and messages about gender and sexuality in a way that, isn't too harsh of like, you don't know anything about, your child's health and well-being. We also have an Amazed Parent playlist that really works with parents to continue to build on dialogue with their children so that conversations aren't as sticky, or there's, a video you can show on, for example, pornography where you don't want to have the conversation, but, there's a video and guided discussion after.
Yeah, that's great. I mean, I think some just like baby steps for some parents. I mean, it is fair to say like generation by generation, there's some differences too. I mean, hopefully, Viandra, your generation, the three of you, like your generation might be the generation that really shifts this to like a much more sex positive kind of culture. I think with, seeing what folks are doing on YouTube and TikTok, I think a much more like feminist way of younger women sort of really claiming and owning their sexuality, their bodies, their gender. I think that's hopefully, a lasting shift. I did wonder though, just thinking about the parent role, do you think there's like one, maybe a couple things parents tend to say or do without realizing that are pretty harmful or stereotyping, or just, there are a couple things you would say, we need to really stop saying this or stop giving this information? Anything come to mind? Okay, well, we'll come back to that.
Sorry. No, I was like, is this for me or is somebody else?
Oh, sorry. Yes, for you.
No, you're fine. You're fine. So I think that, there's several things, right? I think, the baby steps are, having conversations that are normative and friendly around gender and sexuality, right? Using language that is, inclusive. Do you have a partner? Are you talking to anybody? Are you interested in anybody? And I think that we've come a long way too with using resources like Amaze, but also looking at, social media, looking at and thinking about what we're seeing on our TV screens and in movies. Those are really gateway opportunities to say, hey, like, I just watched this show. I saw this movie, Moonlight. The child in the show is talking about, being transgender, or the boy wants to wear a dress or skirt. Do you see that at your school? How do you feel about that? Really using kind of like pop culture, social media to bridge some of those gaps or awkward conversations.
Yeah, for sure. I know there's a lot of variation across the country in terms of, what a school principal would even feel is okay, or maybe there's a state law, like a very archaic state law, that, you're not really supposed to say anything at all positive about, being LGBTQ. And I know that, it's really, I think, even with some of those some of those more conservative areas or conservative organizations or schools that you might find yourself in, it's still like you have individual conversations, right? Like, Viandre, there might have been a teacher who was like a go-to person, or, Avi, there might have been a mentor or somebody who was your go-to person. So even in like if you're in sort of a larger context that's not a very affirming context, each of us in our interaction, one-on-one interaction, can really make a difference. And I know, I mean, you've already mentioned, Viandre, somebody who really sort of shined light on some things for you. Are there some other examples any of you, particularly Avi and Viandre, can share about, people who just kind of like got them and were able to help, whether it's navigating relationships or learning about HIV prevention, or, getting out of challenging situations, those kinds of things?
Yeah, I'd say being an experiment is a big thing within the trans and non-binary community, because not everybody knows who we are and what we're all about, and just the basics of our gender identity. And so when that comes into play, it's like we're kind of used as something that's an experiment. And talking to other trans youth has really helped me. Just talking about those situations and having almost like identical stories is like, whoa, this is happening to you too. And it's just like, whoa, that it's just crazy. And so what I personally do is just like talk about those experiences on social media, so we can continue to just have education and other people learn, like other cis people, because it's important for them to know so they can further be educated for future relationships.
Yeah. Avi, you want to add something to that?
For me, as far as like role models go, there is a specific role model that I speak about a lot in a lot of my speeches, but it was my English teacher in high school. Her name was Heather Anderson. And at the time I was sort of coming out at school, but as soon as I would go home, I would just play the straight boy again. And I was just dealing with a lot of other struggles at home. My mom had had a stroke, and I became her caretaker, and then life just got really difficult for me. I had suffered from suicidal thoughts all throughout growing up, and then it just reached a peak in high school. And I went from being top of my class to no longer showing up. My mom was always in and out of the hospital. So life just got really, really hard for me, and school just became on like a back burner for me. I wasn't able to focus. I just stopped caring. And it was an English teacher who noticed and reached out to me. And she knew I was very intelligent from my writings. And it was her who pulled me aside and encouraged me to open up to her. And because of her, the entire school ended up supporting me and having my back. And they helped me along. It was my first taste of having a safe space for me, because growing up I didn't have any representation. I had no one to show me that what I was okay. So being given an environment like that by my teachers was life-changing for me. It definitely saved my life. And then unfortunately my mom passed, and then I ended up having to relocate, and I ended up in Hawaii, where I was very lucky and fortunate to find another mentor, and it was a trans drag artist in Hawaii who ended up taking me in, letting me live with her, and took me under her wings. And I just went from living such a closeted life to living the most colorful one imaginable. So I was very grateful to be given that, and I owe it to both of them for saving my life.
That's great. Thank you so much. Can't overemphasize the important role we have for our younger generation. So I think when we talk about HIV, we often hear the word stigma. We talk about stigma, and certainly we have stigma related to LGBTQ identities. I wonder if you can think about trying to not only remove the stigma from HIV so that people can ask about it, learn about it, get access to PrEP, get access to testing and treatment, whatever their needs are, but kind of getting at the stigma that's related to LGBTQ identities. That's kind of, intersecting with HIV status. I mean, given the history of HIV and sort of all of the stigma that, early in HIV about, like, this is a, gay man's disease. And I know there's an HBO show now that's kind of revisiting some of that early, the early 80s and just the sort of the stigma around that and the sort of demonization almost of gay and bi men having sex with men back then. So yes, we're like decades later, and yet I think that we're in many ways perpetuating a lot of stigma and shame, certainly around LGBTQ identities. So I wonder if you could speak to, all three of you could speak to how you feel that like things that you've heard and learned that kind of create a sense of stigma or shame about who you are, and how that sort of might, or things that sort of, things that either decrease or kind of increase your sense of stigma or shame related to who you are. So maybe Viandre, do you feel okay starting?
Yeah, for sure. I'd say that just naturally people feel once I tell them I'm trans that I'm like over sexual. And it's such a big stereotype just because of HIV and like why it spread. And it's very frustrating because, I'm just a human. And even if I were sexual, why is that bad? Because every single other person can be sexual. Like, I don't understand why it's not okay to be, because we are all human. And, but that has been a big stereotype pushed. And there's like this feeling of like hiding that and not wanting to be or not wanting to open up about anything because it's like you'll get attacked for it, and it's just very frustrating. So that's something that's been pushed on me, and within the trans community and gay community kind of intersecting.
Yeah. Thanks for sharing that. Monty, do you want to speak a little bit to stigma?
Yeah, I think, dealing with stigma all the time and thinking that it's everywhere, right? It's at the healthcare center, it's at the school, it's right outside going to the liquor store, right? But really realizing and recognizing that, with stigma comes folks like you all on the call that, things are changing. And it is my hope when we're thinking about, stigma, oppression in these systems, that we're also giving and thinking about considerations to things to reduce stigma, whether that is, a show like Pose, or whether that is an ad at the bus stop that features a dad and his son has a rainbow hat and a unicorn costume. So thinking always about stigma and its role, but also giving consideration and, hyping up like, we are or will be soon at a place where, ideas around gender and sexuality aren't solely for academics or solely for people with advanced degrees, but a way that, people can say, hey, mom, I do feel that my gender is this. And the mom will say, well, yeah, I just saw something about that on the news, or I just saw something about that on TV. So, yeah.
I love that. This is all aspirational. That's where we have to go with this. That's what we're going to do. Avi, you shared a story, and essentially, what I took from that is that in second grade, when you just expressed a real feeling, a real human feeling, you got shamed and stigmatized right away. So I'm sure you have a little bit to say on this topic.
Yeah, well, I just couldn't think of any like specifics on like stigmas, because it's just like, I've faced adversity my whole life, and it's just been a constant. It's just a constant thing to just consistently overcome. But like Armante was saying, I just try to stay positive, and I do this work. I do my public speaking, and I just try to educate people as much as possible. To erase all of the stigmas that exist in all aspects of my life and all aspects of my identity, as someone who is queer, as someone who is brown, as someone who is Pacific Islander. It's just, this is such like a layered conversation. So, it's a, but it's just, I'm grateful for events like this, where we get to speak on it and acknowledge it, and work towards fixing what needs to be fixed. So
well, we appreciate you being part of the conversation. I'm wondering if you feel like when you think back, you're all very much younger than I am. Do you remember when you learned about HIV and HIV prevention, and whether that information felt like it was helpful to you based on who you are? Go ahead. Yeah, Andre, go ahead.
Well, actually, right through that show you were talking about Pose, and my mom didn't really teach me about it at a young age because it wasn't something very necessary to just be putting in my head at the time. But I'd just say like Pose really helped it because it was put in a positive light, showed all the feelings behind it, and it just gave like a feeling to it, not just like a stigma. And then I can also relate because they were people who I could identify with personally. So that was how I learned about it. And it was actually in a positive way and not a negative way. But, learning all the different parts of being through it, getting through it, like what it was like at the time. And yeah, that's why I love that show so much. It's actually one of my favorite shows.
That's great.
Yeah.
Avi?
First of all, Pose is the best show ever. I highly recommend it to everyone. Love that show. So I totally agree with everything that Beyonce said. And hold up, I just lost my train of thought because I was busy thinking about Pose.
Well, about when you
got it.
when you learn about HIV. Yeah.
So growing up as a kid, I remember hearing about HIV in like elementary, middle school, and it was just, I always just heard like, oh, all gay people have AIDS, and I remember being told a story of like a man who slept with his boyfriend and then he ended up dying of AIDS. Like it was just so ignorant, so uneducated. Like it was that was all I was taught. And we like briefly covered like use of condoms, but other than that, like it was still such a taboo thing. I didn't learn anything about HIV until after high school, when I met my drag mother, who worked for an organization called Life Foundation, and it's Hawaii's biggest HIV and AIDS prevention group. So I ended up getting all my education not until I was after 18 already.
Right.
But I'm very lucky to have navigated my life without ever contracting it, because you know, the sex education that I was given in school definitely did a disservice to me and a disservice to all people of queer identities, or just all youth in general. Like, this is stuff that they should be learning very young.
Yeah, absolutely. And I think, I mean, you both were, in my opinion, it was, you know, too late. I mean, it's great that you learned, you know, real information about HIV, but it sounds like it came, you know, pretty late for both of you. Viandra, did you want to add something?
Yeah, like your story actually kind of brings up a little memory for me. When being in like elementary school, there was the term like you have AIDS or this is AIDS would always be thrown around as like in a replacement for like you're stupid. So now like it's just kind of all clicking for me, like, whoa, this is really being like a negative thing that's being pushed on everybody without even me knowing what it was at the time.
Yeah. Yeah. Monty, let me ask, we have a few more minutes. I want to ask you, what are your thoughts about kind of some of the cultural and social factors that come into play when we talk? There's not like a one size fits all sexual health education curriculum. I mean, we want it to be LGBT inclusive, meaning like positive representations of LGBTQ people, you know, looking at, you know, a whole healthy range of sexual orientations, gender identity expression, not stigmatizing at all LGBTQ young people and their experiences. But, you know, there are all kinds of, you know, young people in this community. And are there different considerations in, say, teaching kids who come from Black families, Latinx families, certain religious or traditional backgrounds? And how do we be mindful about that?
Yeah, no, I think that, you know, especially given the current moment and thinking about cultural responsiveness, thinking about schools and sex education, when I have conversations like this, I was just talking to my supervisor, Louie, literally about this, that, you know, it's important to name that, you know, thinking about sex education and even thinking about schools have never, not all schools, some schools have never been inherently safe spaces for Black and brown young people. They're heavily policed, so their bodies have to go through a metal detector. Their book bags have to be clear. They're already inherently taught that they're a danger to society and themselves. When we talk about HIV and STIs, this is also historically the model. Teen pregnancy has always been, you know, focused as like it's the Puerto Rican and African American girl's fault. And with HIV, it's been you're Black and gay and you're high at risk. These considerations, you know, literally have, you know, these cultural connotations around messaging. But it's also important to really get rid of the idea that, you know, Black, Latinx, brown folks are culturally resistant to having conversations around sex education. So it's like, you know, narratives of like Latino folks are Catholic. They don't want to talk about sex. And instead of looking at cultural things, really getting at, no, it's actually a legislator who's either federal or state or local that's not allowing comprehensive sex education, and they're only focusing on abstinence, right? Like the Latinx families are ready to talk about sexuality education. They're ready to have conversations that, you know, blend in Afro-Latinx identities like we saw in Pose with information about sexual health, only if they're able to in the school systems. So really taking back the idea of, you know, it's this role's fault, this person's fault, and like, what is the system doing to provide people with that information? You know, the other thing we talk about a lot is like looking at sexual health educators, right? It's a predominantly white field, and like, there's always been this narrative that, you know, Black and brown sexual health educators who are culturally competent, who come from those backgrounds, are hard to find. And it's like, are they hard to find? Are we not hiring them? Like, what are the systematic things? Are there not, you know, federal funding or a training program that we could come up with to increase the number of culturally competent sexuality education providers? So really just thinking about all of that and thinking of, you know, there is this cultural thing, but like looking at culture in contrast to legislators that are not allowing anything but abstinence only sex ed in their schools.
Yeah, as you said, it's very layered, and we probably would need another hour to get to all the layers. I want to thank you all. I'd like, in our last minute, if each of you could just say like one thing that folks listening who are, either providers or educators or advocates, what's one thing you feel that folks could do right away to really make a difference in how we're educating young people on topics of sexual health? Deandre, I'll put you on the spot and go ahead.
Raise our voices, please. Let us speak. Don't speak for us. We are the people who are going to put forward pushing out these stigmas and, just being the representation. Me and Avi are obviously some educators you could lift up. And I'm constantly speaking out on social media all the time. So just repost, just talk about us, and please talk about us in a positive light, because putting us in that frame is going to only help our community.
Excellent. Avi?
I would just say everything that Andrea just said. When you are teaching these things, always think about whose identities, whose behaviors, whose experiences are being left out. And think about us when you're teaching, and definitely allow us to speak. Like representation definitely matters. So yeah.
Absolutely. And Amonte.
Yeah, I think echoing everything everyone said, also check out our resources, advocatesforyouth.org. We have tons of resources around comprehensive sexuality education.
Great. And I'll speak to any parents. And, some of us are, school nurses or policymakers or work in public health, but we also come home and have kids, and our kids might be 2 or 5 or 12 or 18. We might know whether they're a part of the LGBT community. We might not know that. But think about the kinds of conversations you're having at home. You all gave great examples of asking questions, watching TV shows together, keeping questions open-ended, speaking in affirming ways of folks who have a sexual orientation or gender identity that's something other than cisgender or heterosexual. Just sending those positive messages and, sending the message to young people who are within earshot that you are a safe, open person for them to talk to and ask questions of, because that's how we're all going to learn. So I want to thank you. Looking forward to doing a lot more work in this space, and appreciate Gilead investing in this work. And we'll see you all sometime soon. Thanks to our guests.
Bye. Thank you so much.